If you've been following our program for the past 4 weeks, this will be our 5th week, you know that we've been addressing all aspects of bullying. We've looked at cyberbullying, face-to-face bullying. We've talked about mental health concerns in general, and we've looked specifically at things such as eating disorders, depression, anxiety, as they relate to bullying. Tonight, our focus is going to be on the real, I guess the most traumatic aspect of bullying that can happen, which are suicides and homicides. The fallout from that is traumatic for everyone concerned, even if we're just hearing about it on the news. It's very troubling and very traumatic. Tonight, my guest is Dr. Paul Clark. He was here with us last week, and he'll be here with us again tonight to continue to address this real serious concern that's plaguing, I guess is the best way to put it, plaguing society today. Thank you, Dr. Clark. Welcome again.
Thank you, Narda.
And maybe you can just quickly share for the audience a little bit about what you do, your work here in Mississauga.
Sure. I'm a counselor in Mississauga, and I help families, youth, couples that are going through all kinds of changes, crisis. This is not my first job. My first job was I was a teacher, and later a professor, and eventually I taught teachers, but I'm doing this now, and it looks like I'm going to be doing it for the foreseeable future. So, yeah.
Good. And as you're saying, you're working with people from all different backgrounds, dealing with all aspects, and as we discussed last week, some of those issues that you're dealing with include depression and anxiety.
Yes.
And we were looking at last week how the experience of being bullied can often result in some of these traumatic events. We talked a fair bit about depression last week, but I wondered maybe if we could just quickly kind of recap for maybe people who weren't involved in the program last week, and maybe they did and, you know, needed to have a little bit more info. So if we could just do a quick recap around what depression is all about and some of the symptoms, the way it presents itself.
Depression would be sort of an overwhelming sense of hopelessness, sadness, such that, you know, in extreme cases, the person doesn't want to continue their activities. They often will sleep all the time or not sleep at all, stop eating, sort of. But I would say sadness and hopelessness, usually aggravated by some form of stress.
Right. Definitely. Stress such as being bullied.
Right, stress
That's
as
one
being
that
bullied
would
is an
aggravate
excellent
it.
way. You know, it's very often, and, you know, one of the things that, you know, if you look at a case like Amanda Todd, she was already on so many antidepressants and anxiety medications that would be unusual.
I didn't realize that.
For a child of that age, that almost certainly came about as a consequence of the bullying she'd already received. But, you know, medications are only part of a solution, and if the stress keeps increasing or, you know, there's no resolution, then it wasn't enough. It was too little, too late, I think. But
No, we focused on depression. Can you give us some insight in terms of how that differs or is similar? What part, I guess, anxiety plays into that? Because I guess you're not, if you're depressed, you're also anxious, or no?
Not necessarily.
Okay.
Some people are only depressed. Often they come together. Often people will either get an anxiety, would be a stress or tension, a fear, an overwhelming fear, or like as if something terrifying is happening, to the point where eventually people have panic attacks. But and a lot of people who suffer from depression also become anxious, or people who are anxious also start to suffer from depression, but not necessarily. Some people suffer just from one. They just become depressed, or some people just become anxious. And yeah, and so, in fact, that clinical sort of version, I would say I see many more who tend to suffer from one much more than another, although many don't know there is a difference. They just feel bad.
Right.
And developing a vocabulary, I go, well, you know, and I describe the symptoms. They come in complaining of depression, and I go, well, do you, and they say, no, I don't have anxiety. And then you say, well, do you sweat? Do you get nervous? Does your heart beat quickly? They go, oh, yeah. And I go, well, that's kind of anxiety. But they're not necessarily aware.
Okay,
Yeah.
no, that's interesting and important to know because obviously I had that similar kind of take, you know, that they seem to be hand in hand, but you're identifying that
They
not
can,
necessarily.
not necessarily. People, as I say, people can be, when they come into my office, they tend to suffer from some, you know, if they're under a very stressful situation right now, they'll say they're suffering from both in the last 3 months or something like that, where they're getting both. But if somebody struggles for something for a long time, it tends to be one or the other. Yeah.
Oh, okay.
So, and they may be on, now again, the medications may be similar even. So, because some antidepressants work as anti-anxiety medications. So, and again, this lack of vocabulary, or sometimes people, depending on the doctor, they aren't great at diagnosing what the complaint is because that person doesn't have a clear way to describe how they're feeling. So, there can be some confusion.
Sure.
Yeah.
Just to back up a little bit, because you brought in the subject of medication, and we didn't really talk about that last time, but it's good that you brought it, because I know that there are people with chronic cases of depression or anxiety that's clearly a mental health concern that this particular person is predisposed to. Which, for somebody that's experiencing severe trauma, such as being bullied, but it could be for other reasons, that in itself can result in somebody becoming depressed, even if they didn't have the predisposition to being depressed.
Yeah, well, you know, and I'm not sure what we would call a predisposition. It may be, you know, in my experience, you know, people describing sort of an organic beginning to depression or an organic, but in almost all the cases, if you look far enough back, there's some catalyst or stressor that began, you know, and by the same token, if that student or that person had not experienced a really acute stressful period in their life, that might have remained latent forever. They might never have had the depression, but once it's, you know, we talk about the rain barrel, when it rains, you know, it takes a long time for that rain barrel to fill up, but then once it rains, every time it does, it spills over. So once you've gotten to critical mass, whatever that is, and for some people, again, it's high school, for some people you don't see, like, people don't develop symptoms until later in their life, and then, you know, a fire or a violence, you know, something traumatic. But when we start to peel back the layers, we discover that wasn't the first event. That was just the straw that broke the camel's back. And often there is a history of bullying or family abuse or something. They've just been able to deal with it for this long. Yeah.
So in that, because the point I was getting at to ask if there were situations where somebody may be depressed and medication would not be the right way to go. But what you're saying that in most situations there is some organic thing happening anyway, so even if the issue was bullying that triggered the person becoming depressed, medication would still be an option in terms of treating them.
Well, you know, we tend to just go like pain. We manage depression and anxiety by scales. You know, and so when someone comes in and go, okay, I ask them for depression, okay, where 10 is I'm as happy as can be, and 1 is I'm going to commit suicide right after I leave the office. What number are you? And if they tell me they're a 2, I don't care how they got there. If they are seriously considering self-harm or suicide, we've got to look at now all of our options, including medications. You know, because at least for now, at least as a temporary measure, yes, if things settle down, there may come a time when you want. But it seems to me we want to come at those problems from all sides. So even me, and medication is not my area, one of the things I go is like, if this is like alarm bells, right? This
Right,
is the sirens
right.
going off, or my anxiety is, 9 out of 10. This is serious. So we can talk all we want, but at this point in your life, if your stress level is so high that you feel you're going to be hospitalized, just to reduce the symptoms, so
Okay.
that you can get into the office.
Right,
So,
right.
often.
Oh, that's interesting and important to know, because I've often wondered, and I'm sure there may be viewers out there wondering the same thing, like, do I need to take
and
medication?
there's
Should I? No.
there's a huge, and a lot of people come in and they go, no, I'm not taking any medication.
Yeah.
And so, yeah, I tend to, like if I thought magic crystals would help you, I want this person, my client, to be feeling better as
Right.
quickly as possible.
Right.
So, and we're very hesitant again when it comes to psychological medications. It's a totally different ball of wax, but we are talking fundamentally your health, your quality of life. And if your doctor told you, look, you've got diabetes, you need to take
True.
insulin,
That's true.
people are not going to go, well, I'm not taking any of that medicine, but for some reason when we come to a
That is
psychological
so true.
medicine, people go, I don't want to mess with my mind, but it's on that same level. It's a serious...
On that point, because in my experience working, and I was speaking to you earlier, I have a lot of experience working like in schools and treatment center with kids from birth almost to up to 18, 19 years old, and families. And, lots of behavioral concerns, parenting concerns, challenges. And often that's one of the things where parents, and I understand where it's coming from, but would have the largest concern around medicating or, from their perception, over medicating their young child. So let's look at a young child or a teen in a situation, where they're being bullied, they're being traumatized, and as a result, now they're extremely anxious or depressed. Would you also be looking at medicating that particular person as well?
Again, and
We believe that where you watch TV should be up to you. With Rogers Anyplace TV, you can watch more TV shows